Good morning, everyone. You are watching Barnstable this morning. And joining me now on the phone is Director of Senior Services, Madeline Noonan. Good morning, Madeline.
Hi, Sarah. How are you on this lovely day?
I am doing well. How about yourself?
Great, thank you.
So excited to chat with you. I know last week Town Council actually passed some really important measures for the Senior Center. I want to hear a little bit about those more in depth if possible. Talk to me a little bit about the needs assessment that was approved at Town Council last week.
Yeah, absolutely. This is a big deal for us at the Senior Centre, and we're really excited to be moving forward with this project. We've been having discussions really probably for about almost 2 years now about moving forward with the needs assessment study, really to help us plan our future growth and direction for the Senior Services Division. As you know, I mean, the Senior Centre is a very thriving facility, and, you know, we're very fortunate to have such a first-class facility in the town of Barnstable. But, you know, for a long time we've been really trying to plan, you know, both for the short term and long term, you know, where we need to focus our resources on. And so there had been a couple of other communities in the state that we had read about that had, you know, commissioned needs assessment studies using UMass Boston's Gerontology Institute. And we had seen the finished documents. I had spoken to some of the directors in those communities, which included Hingham, Marshfield, Cohasset, and actually closer to home, Falmouth was the last community to complete this process. And you know, really to see the process take shape and result in, you know, the final document that, like, you know, that really has worked for these communities and in how they're approaching, you know, their long-term planning efforts. And we felt very strongly that this was something that, you know, it was timely for us to do. You know, the Senior Centre, we just celebrated our 15-year anniversary this year in June. So it's a really good time for us to start looking forward, you know, to our next 15 years and beyond. Looking at the demographics in town, you know, we have 28% of our population is over 60, and we really felt that it was something we needed to bring some experts in. And as I said, the UMass Boston Gerontology Institute, they've done a number of these studies. They are looked on as, you know, the gold standard. So we had reached out to them. We had sent in a request to the town for the FY15 budget, and luckily, I mean, we got the support of the town council and the town manager, and they approved $25,000 in funding towards the project. The total cost is $35,000, so we were fortunate that our friends group, who always come in and jump to, you know, assist us with, you know, important projects at the Senior Centre, had offered to come up with the difference. So for us to be able to get the funding from both the town and the Friends was a huge show of support for what we do, and we're excited now to be about to move forward and start this process.
Yeah, really exciting, Madeline. Tell me a little bit more about what is going to be sort of the focus of this needs assessment. Is this something that, you know, will sort of tell you what programs you need to expand, or maybe what programs you need to add for the Senior Center? What kind of, how will they conduct this assessment?
Great. These are great questions, and this is why there's so much to talk about with this. You know, I think it's going to be a very interesting process. It's going to take about a year, so hopefully, you know, this time next year we'll be coming to the end. But for the start of it, what we're really looking for, we've had a couple of sit-down meetings with the working group, which consists of some of the board members from the Council on Aging and the Friends and some town staff, and our town council liaison, Councillor Cushing. We've really sat down and tried to develop the scope of what the project is, because there's so much you could focus your efforts on. For us, we're really looking to see, you know, to hear directly from the community. We want to know what older adults in Barnstable want the Senior Services Division, not just the Senior Centre, but the programs that we offer that go beyond the walls of the Senior Centre, what they want us to be and how we can assist them. So we really need to get a good idea of what their current conditions are, you know, what concerns them, you know, as far as aging, you know, where they see themselves, you know, as they approach, you know, their older years. And then for us, I think that's going to be a huge learning piece, because we're going to be hearing directly from the community, and then we're also going to be sharing a lot of information about what we have. So we're looking on this as there's a marketing piece of this, where we're hoping that people, if they didn't have us on their radar before, that they will now, and that they might be more likely to come here. It's also focused not just on the senior, you know, 60-plus population, but some of the study will be focused on the boomers and the younger seniors. So anyone 50-plus, you know, we're looking to hear from them directly. And, you know, when you look at the different elements of the study, it will include focus groups that we'll be having with the police and fire departments. We're looking at sort of a public safety piece of it, and also a programming piece, as in terms of like what kind of programs and activities do people want to see offered at the senior center, and to bring them in. We want to know what is going to help people use the senior center in the future. There'll also be a demographic analysis, which will be very intensive and will, bring a lot of data to light for us, and also some peer comparison studies. So UMass will take, Barnstable, our community, our senior center, our budget, our staffing, and compare it to similar-sized communities elsewhere in the state to see how we measure up against them. And then one of the really exciting parts is a survey. There will be a community survey that will be done. UMass will be sending out approximately 4,300 surveys that will be randomly selected using the town records to anyone over 50 plus. So they're trying to get responses from about 20% of the 50 plus population of Barnstable, and that will be a very detailed survey that's going to kind of cover all areas of people's lives, including demographic data, their living conditions, what their concerns are about, retiring, and their knowledge of the senior center. And then there will also be a community questionnaire, which is a little more scaled down, simplified version of the community survey that we will be distributing throughout town. And then to kick off the project, we're offering on October 7th, which is coming up, just a few weeks from now, we're going to start the process off with a community forum at the senior center, and this is where we want to hear directly from anyone in the community, regardless of age, but more targeted at the 50 plus population, to come in here and meet with us. We're going to have 2 sessions. One is at 2 p.m. and the second one is at 5:30 p.m. because we wanted to make sure that we offered people the opportunity to come in if they were still working during the day and couldn't make the 2 p.m. session, that we offered an after hours evening session that would be more likely to attract some of the younger seniors and other older seniors who are unable to make the other session, and that will be facilitated by Professor Jan Mutchler, who we're working with at UMass Boston. She will facilitate it, and it's really an opportunity for us to hear directly from people. Essentially, it's going to be a SWOT analysis, so we're going to hear from people about what they believe are the strengths of the senior center, what our weaknesses are, and where are the areas for opportunity and growth for us. So it's very exciting.
Really exciting. Yeah, really exciting stuff. I mean, I know there's so many things happen over at the senior center. It's great to take a moment to sort of reassess and evaluate
absolutely
everything that's going on. I wanted to talk to you too. Also, another thing that happened last week at Town Council is the council actually voted to allow an acceptance of a gift of $4,000 for the Aging Mastery program. What is that program, Madeline?
Well, it's a very exciting program, and we are thrilled to pieces to have been approved for funding for this program. This program was developed by the National Council on Aging, which represents all of the senior centers, throughout the 50 states. They came up with this idea that senior centers typically offer lots of talks and workshops and presentations and information on all of the areas that are core to the aging process. So that's something that we do on an ongoing basis. We give lots of talks and presentations. But what the Aging Mastery program is, it takes all of these, core elements of aging and has put them together in this really neat package. And basically what we're going to do is we're going to offer, it's in Barnstable, it's going to be 14 weeks. We're going to offer 14 weeks of classes that cover all of the elements of aging, so that the participants that take this program are going to become very informed and educated and also empowered. That's a key piece of this program, is that every week when we cover a different topic, there'll be lots of good information that will be provided, but the other key piece is that the participants will hopefully make some positive changes to their health concerns. And in return for making good decisions and taking action steps, they will be rewarded with points. And at the end of the 14 weeks, we're going to add up all of the points that each participant has accumulated, and they will be able to get a prize, a reward that would be valued up to $20. So for us, there's a real incentive, for this program. We're one of the first communities, I believe we're one of the first 22 communities in the nation that is offering this program. It's a very exciting opportunity for us. Just to talk about the core topics, we're going to cover everything from physical activity, healthy eating, sleeping well, medication management, planning for your future, communicating with your doctors, fall prevention, and Medicare's prevention benefits. So they are the core 8 topics that NCOA has developed. But then we get to add in a few weeks of our own topics that we get to come up with and add a little unique twist on that. And then the last week, as I said, it's 14 weeks. The last week of classes, we're actually going to have a luncheon for the participants, and they get a certificate of graduation. So they have this real sense of accomplishment that they've completed something. There's just so many benefits to this program. I mean, obviously people are going to become much more, aware of the aging process and feel much more in control of that, and also get to meet new friends. There's a whole social connection piece of it. We're excited that we get to partner with Cape Cod Healthcare. They are going to be providing the speakers. They have lots of expert physicians and staff that can come in and talk about these topics. So it's a really great program.
Yeah, I can imagine too it would be very comforting to know that a whole other group of people are surrounding you that are going through some of the same things you are experiencing as well, which is always comforting. I want to ask you this, Madeline, is there a fee for participants, or does the grant pay for the entire program?
The grant is going to cover the entire program, which is amazing. So we received $4,000. It's actually come through the Executive Office of Elder Affairs through the Massachusetts Council on Aging, are supporting the program. It's open to anyone 50 plus. So, this isn't really directed at the, older, population as much as, people who are maybe thinking, of retirement coming up. So anyone 50 plus. I mean, it doesn't matter if you want to take it when you're 80 or 90, or if you're 50. There's something that I think can appeal to everyone, who is thinking about, the later years. And, we talk oftentimes about how important it is to plan ahead and not wait until you're in a crisis situation. So I think the information that will be passed on to people is going to be enormously helpful for them as they do plan for their future years. And it's also a great way for them to become familiar with the Senior Centre and all of the great programs and services that we offer here. And our hope is that if people read about this program and hear about how exciting and fun it is, it's very innovative, that they may want to come in, participate, in this, and hopefully they will, understand that we have so much else going on that they can continue to participate in after the program ends.
Wonderful, so exciting. Do you know, Madeline, how early individuals who may be interested in the program will be able to sign up?
Yeah, they can actually call us anytime now. The program is it's scheduled to start on October 15th, and it will run all the way through February 4th. The first week is really an overview and to go over. There's lots of details with the program as far as tracking the points and sort of giving an overview of what's entailed. But if people want to sign up now, they can just call the Senior Centre as they can for any information they need. Our main line is 508-862-4750, and for this program specifically, they can ask for me or Donna Burns, who's our assistant director, because we will be co-leading the program.
Great, wonderful. Well, thank you so much for joining us today, Madeline, and sharing all of this great news with us. We really appreciate it, and we look forward to chatting with you in the next few weeks.
Thanks, Sarah. Take care. Take care.
You too. Bye-bye,
Bye-bye.
Madeline. Madeline Noonan is the Director of Senior Services for the town of Barnstable. For Barnstable This Morning, I'm Sarah Mannel.